Thank you for joining us for our session on disease management, Veterans Affairs response to kidney disease. I'm Ed Hickey, Vice President of AAKP, Chair of the AAKP Veterans Health Initiative, and a fellow kidney patient. As a former Marine, it's been my honor to lead AAKP's efforts in supporting veterans who are managing kidney disease and their care choices as patient consumers. The AAKP Veterans Health Initiative was designed to safeguard the choices available to veterans through the VA system. Our initiative has been bold in its efforts to work productively alongside the VA as an ally. We help advance the research, innovation, and policies aimed at safeguarding the highest standards in kidney care treatment for veterans managing kidney disease, both inside and outside the VA medical system. Veterans and their families face many unique challenges related to managing their health care, and this is especially true for veterans who suffer from kidney and other complex chronic diseases. As the son of a veteran and the father of 3 service members, I know these issues quite well. AAKP is fully committed to supporting fellow veterans in having their voice heard, retaining access to the care they have earned and are legally entitled to at the VA and elsewhere. And we remain a highly effective partner in efforts to help veterans gain the benefit of new research and innovations in the realms of biologics, diagnostics, and devices. Today, we are honored to have a good friend of AAKP and fellow champion of the veterans, Dr. Paul Palevsky. Dr. Palevsky is a professor of medicine at the University of Pittsburgh School of Medicine and the deputy director of the VA Kidney Disease and Dialysis Program. He is also the current president of the National Kidney Foundation. We work closely with Dr. Palevsky on many issues over the past several years and view him as a true and relentless patient advocate. He respects the dignity and insights of every patient equally and leaves no patient behind. For our session today, I'd like to ask you a few questions, Doctor, and allow you to expand on the Veterans Affairs response to kidney disease. To start off, AAKP has been a staunch ally to kidney veterans in the VA health program throughout our history, and since 2018, through our Veterans Health Initiative. Can you discuss the VA efforts in kidney research, the role of veterans and their unique insights, and how that research is impacting innovation both within the VA and beyond?
Certainly. Let me start by thanking you personally for your service, your family's service, and AAKP for all that it does in supporting veterans with kidney disease. Your support makes our job caring for patients with kidney disease all that easier. In terms of the VA research, VA has been a mover in research in kidney disease for many, many years. The kidney disease program has had research, patient-oriented research, dating back decades. Early studies looking at the benefits of subcutaneous versus intravenous erythropoietin, studies looking at vascular access for dialysis, methods to minimize cardiovascular complications in patients with kidney disease. I was privileged to lead a study looking at the management of kidney replacement therapy for patients with acute kidney injury that the VA led in collaboration with the National Institutes of Health. Studies looking at novel therapies, including dual blockade of the renin-angiotensin system with lisinopril and losartan as compared to losartan alone in diabetics, studies to minimize the risk of complications from contrast administration. The list is very long. Recently, epidemiologic studies that have just been published looking at the impacts of COVID on kidney disease in veterans. So the VA has really invested a tremendous amount in advancing knowledge in patients with kidney disease that's informed both care within the VA and in the larger community.
Thank you. So following up on that, in light of the research, can you describe to our patients the overall scope of the VA kidney program, including the VA's online e-kidney clinic?
Certainly. So the VA runs its own dialysis programs. In fact, the VA dialysis program predates the Medicare benefit with chronic dialysis programs that started during the 1960s. There are 70 VAs or around 70 VAs that have their own dialysis programs. Some of them are based within the VA hospitals themselves. There are a number of VA clinics, VA dialysis clinics that are separate from dialysis from the VA medical centers as satellite units. We provide care for about 3,000 veterans directly. We have home dialysis programs that provide both peritoneal dialysis and home hemodialysis. The number of veterans with kidney disease, though, far exceeds the capacity of the in-house dialysis programs, and the small number of VA dialysis units really geographically is problematic for taking care of veterans across the country. So the vast majority of veterans with kidney failure who require ongoing dialysis receive that care under the Community Care Program, now the Mission Act, under contract with non-VA dialysis programs, the large dialysis organizations, and multiple other dialysis providers. The VA has its own kidney transplant program. There are, I believe, 8 transplant centers, kidney transplant centers now that provide kidney transplants. So in Pittsburgh, we have one of those centers, and there are also centers at Nashville, at the affiliated with Vanderbilt, at the Bronx VA affiliated with Mount Sinai Hospital, at the Hines VA outside of Chicago, affiliated with Loyola, at the Birmingham VA in Alabama, affiliated with the University of Alabama, Birmingham, with the Houston VA, affiliated with Baylor Medical School, in Iowa City, affiliated with the University of Iowa, and in Portland, Oregon, affiliated with Oregon University for the Health Sciences. Any veteran who has kidney failure and otherwise would be eligible for a kidney transplant can get that transplant through the VA, including living donor transplants. Just as any veteran who is eligible for care within the VA is eligible for dialysis. That's a point that I didn't make. But obviously, care for patients with kidney disease extends far beyond transplantation and dialysis. Our goal is to prevent patients from progressing to kidney failure. And to that end, we have a very large program for the care of patients with chronic kidney disease. And as you referenced, one of the resources that we have is an electronic resource, the eKidney Clinic, that's accessible online to provide patients with education about kidney disease and access to the VA resources.
That's amazing. We at AAKP, we hold the VA kidney program up as an example of how the patient-consumer care choice should work in terms of the patients choosing, with the help of their doctor, care that aligns with their aspirations. You had mentioned a little bit about the veterans transplant options and the dialysis options. Can you discuss that a little further?
Certainly. So as I said, any veteran who has kidney disease and is eligible for care within the VA, who requires dialysis, is eligible for VA paid care. As I talked about, we have approximately 70 dialysis units within the VA, and caring for about 3,000 patients, but we have close to 18,000 other veterans who require dialysis who we can't accommodate within the VA dialysis program per se. So we arrange for those veterans to be dialyzed at dialysis units close to home, and the VA will pay the entire cost of the dialysis and the nephrology care, less any VA associated co-payments. There are co-payments within the VA system depending upon service-connected status and financial ability to pay. So a means test that the VA conducts. As I said, we have 8 transplant programs. Veterans can be referred within the VA for transplant. They can be referred actually to multiple VAs. So we often transplant patients who are from outside of region. If we have a patient, say from Florida, who is listed in our transplant program in Pittsburgh, the VA will pay for the veteran and a caregiver to come to Pittsburgh, not only for the evaluation, but then when a kidney is available, we fly them up for their transplant. The veteran can stay in the local area for us until they're medically stable to have their care transferred back to their local VA, or to a non-VA nephrologist. There also is the option for veterans to be referred under the Mission Act to non-VA transplant programs, but our data suggests that we actually have better outcomes for veterans who are transplanted and continue to receive their transplant care within the VA than the veterans who are receiving care within the general community. So our goal is to be able to accommodate as many veterans within the in-house program as possible.
And any veteran within the VA healthcare system who has kidney disease is eligible for at least taking advantage of those options?
Absolutely. So long as they're eligible for primary care within the VA, they are eligible, if they have kidney disease, for all of the kidney benefits that we provide.
Well, that's wonderful. So currently we're in the midst of a pandemic, as I'm sure everyone is aware. And in light of COVID-19, can you tell our viewers how the pandemic has impacted VA kidney care and your best advice to veterans and their families on how to stay safe?
So obviously it has had a major effect on care within the VA, just as it's had a major effect on care at all healthcare institutions around the country. We have implemented similar safety protocols for our veterans on dialysis. And let me start with the dialysis population first, as the dialysis organizations outside the VA have done. VA was actually a leader in making sure that our veterans with kidney failure were vaccinated when the vaccine became available in December. The VA prioritized veterans with kidney disease to be vaccinated, and not only within our own dialysis units, but we made an effort at bringing veterans who were on dialysis in the community back in to get vaccinated. And have achieved very, very high vaccination rates in most of the VA facilities, exceeding 90% of veterans with kidney failure who are immunized. Similarly, for our transplant patients, and we've now begun aggressive outreach starting last month when the CDC and FDA approved the third dose for immunocompromised individuals to make sure that all of our immunocompromised veterans were brought in. The VA has a lot of veterans who are in long-term care facilities. Within VA long-term care facilities, we saw having them move back and forth to dialysis being a challenge. So I'm actually personally proud of the fact that our program in Pittsburgh was the first to stand up a dialysis program within our long-term care facility, specifically to protect those veterans. And we had about a quarter of our dialysis population who were long-term care facility residents, to protect them from being exposed as a result of needing to be transported back and forth for dialysis. This actually, I think, was a very patient-centered approach, because I think it's much better for our veterans to be able to provide that dialysis for them in the long-term care facility, rather than subjecting them to the inconvenience of transportation between facilities. And a number of other VA facilities have stood up similar programs. We've seen a tremendous expansion in our telehealth for our veterans with kidney disease, which has protected them by keeping them from needing to come back into the VA to be seen. And we've the approach, I think, has also enhanced the care, so that our patients don't have to deal with the burden of transportation. Many of our veterans have large distances to travel, and with virtual care, we've, I think, improved the access to care for veterans with that program really driven forward much faster than it otherwise would have been as a result of COVID.
Well, thank you for those efforts, and I guess specifically the good advice to the veterans and their families on how to stay safe would be like telehealth and avoid crowds and get vaccinated.
Absolutely. In particular, get vaccinated. If you're immunocompromised, wear a mask, even if you're vaccinated. With the Delta virus wreaking havoc across the country, protect yourself as best as possible. One of the other important things to recognize, the VA will also immunize caregivers, so that veteran spouses, family members who are helping to care for them are actually eligible to be immunized within the VA, as well as the veteran themselves.
That's fantastic. So my next question is, I know that both you and the VA have been very committed to the issues of disparities in the diagnosis and treatment of kidney disease. And many people may not be fully aware of your leadership personally and as an agency on this issue. Can you address what the VA has underway and how you are addressing the issues of the removal of race from the calculation of EGFR?
Certainly. This has been a major issue over the course of the past several years, particularly the last year, with calls for changes to the equation that's used for calculation of estimated GFR, an equation that adjusts for Black or African American race, elevating the GFR, and some people raising the concern that this may decrease access to care and decrease the ability of veterans and actually all individuals who are minority to be referred for kidney transplantation. The American Society of Nephrology and the National Kidney Foundation convened a task force about a year ago to address this issue. The task force report will be issued within the next several days. In fact, by the time this recording is played, the task force recommendations should be publicly available. The VA has committed to implementing the task force's recommendation as rapidly as possible, and we're already working with the laboratory service to implement the new equation that's going to be recommended literally as rapidly as we can get our computer folks to do the computer programming that will be necessary for implementation. Now, the EGFR equation is only one aspect of factors that lead to racial disparities, and we're very committed to making sure that the care that is provided to every veteran is the optimal care for that veteran, independent of age, sex, race, ethnicity. It shouldn't matter whether you are a white female, a Hispanic male, an African-American woman with kidney disease. Your care should be the same regardless of those other factors, your sex, or race or ethnicity. And the VA is strongly committed to that.
Thank you, Dr. As are we. And one final question for you. So at the AAKP annual national patient meeting, we feature extensive skill training on policy analysis and process, including the implementation of legislation. Can you just, you had touched on it earlier, but can you discuss the Mission Act and its impact on veterans care, especially veterans with kidney disease?
So this is a work in evolution as the VA is implementing the Mission Act. What the Mission Act is designed to do is to ensure that capacity issues within the VA, so not being able to be seen for either primary care or specialty care within a reasonable time period defined within 4 weeks, or barriers because of distance to travel don't impede the ability to receive both primary care and specialty care. So individuals who live more than 60 minutes away from a VA facility with nephrology care can be referred for nephrology care to a community nephrologist. Now, we obviously want to keep veterans being cared for by VA nephrologists to the greatest extent possible. We have much greater control over the quality of care when that's the case, but we realize that for patients who live at considerable distance, it's really not practical, particularly when someone is approaching end-stage kidney disease and is going to be starting on dialysis soon, for them to be traveling back and forth for 2 hours to come in for a clinic visit that may be every 2 weeks or every 4 weeks. So in those cases, we will authorize our veterans to be referred out to providers in their local community to assume their care. Now, the downside to that is there's a disruption in continuity of care, and we often don't have the records of the care that's provided as smoothly as we would like, since one of the drawbacks across the entire United States is that our health information infrastructure is not a unified infrastructure. And if you go to one hospital, the data doesn't necessarily show up in another hospital's database. I already alluded to the use of the Mission Act for veterans requiring dialysis and the ability to receive care under the Mission Act for kidney transplantation.
And you had mentioned a point earlier that the outcomes, you have recent studies that show that the outcomes for kidney patients are more favorable for those who stay within the VA system than those who take advantage of the Mission Act. Is that?
So this was data that actually preceded the Mission Act, but it was data looking at individuals who receive their transplant care using their Medicare or Medicaid benefits as compared to veterans who, and it was veterans using Medicare, Medicaid benefits versus veterans who receive their transplants and their post-transplant care through the VA. And both graft survival and patient survival was actually better in the individuals who stayed within the VA. Now, this is non-randomized data. There are selection issues, but even after statistical adjustment, the results look quite robust.
Well, that's terrific. Well, thank you very much, Dr. Palevsky. This has been a great session, and the overview of the VA support for the kidney community is just tremendous. We appreciate everything that you do, and we thank you for joining us today.
It's been my pleasure, and again, I thank the AAKP for all that you do supporting veterans with kidney disease.